Hi, my name is Dr. Matt Bregman. Congratulations on your choice to pursue weight loss surgery. You've made an excellent choice with Advanced Surgical Partners and Parham Doctors Hospital. Parham Doctors Hospital is recognized as a leader in all the service lines we provide here: orthopedics, bariatrics, and behavioral health. And Advanced Surgical Partners is a leading practice in bariatric surgery in the Central Virginia region. We're recognized as a preferred provider with all major insurers, so you should have confidence that you're going to be treated well. As the medical director for the bariatric program at Parham Doctors Hospital, I'm proud to say we're accredited by the MBSA QIP, American Society of Metabolic and Bariatric Surgery Quality Program. In addition, we're recognized by the Blue Cross Center of Distinction Plus certification. Now that you've decided that you're going to pursue weight loss surgery, you're probably asking yourself, what happens next? When do I get to have surgery? You've obviously waited many years, as most people have, to make this decision. There's a few things we need to do along the way. First thing is, after you make your appointment, when you viewed the videos, we're going to check your insurance. Most insurance providers have specific requirements for what needs to happen between the time you see us and the time you have surgery. Largely, the time it takes to get from your first appointment to surgery will depend on those requirements. Some things everybody who pursues weight loss surgery will have to perform regardless of where you have the surgery. Those things are a visit with the dietitian. This is a 1-hour visit. We're going to go over all the dietary changes that are associated with your choice of operation, what you can expect before, and what your lifestyle will be like after surgery. Every patient will be referred for a psychologic assessment. I think we all recognize that when we get stressed, sometimes we choose food as the method by which we soothe our stress. And that's normal. For a small fraction of the people that come to see us, that stress is the primary reason that they're overweight. For those individuals, they are still candidates for weight loss surgery, but in order to be maximally successful, we need to use other resources, specifically behavioral health resources, to help our progress in losing weight. The majority of patients who come to see us here in Richmond are going to have insurance that requires them to have a certain number of visits with a physician regarding weight and weight management prior to surgery. For some people, that's 3 visits. For others, it's 6. And for a few, it's even 12. We're going to find that information out for you prior to when you come to see us, and we're going to have a plan for you when you arrive. You'll have the option of doing those visits with your own provider or with one of ours. Should you choose to use our providers, we have a curriculum that's tailored to the duration that you need to perform to help and inform you and prepare you for surgery and for what life will be like after surgery. Once you have completed your psychologic assessment, your nutritional education, and whatever insurance mandated visits with your provider, then we're going to go into the immediate pre-surgical time frame. There's a few things that have to happen there. So one is we need to see you back, because it's likely that we haven't seen you for several months, to assure you haven't developed any new diagnoses, had any other medical issues or admissions to the hospital, and just refresh our memory on what your choices are regarding your surgery. You're also going to have a class that will occur at the hospital to orient you to the actual surgical experience. Our coordinator from the hospital will educate you on the morning of surgery, the surgery itself, and what will be expected for that day that you're with us in terms of mobilization and diet and what the nurses will and will not do for you. The final thing is, for the 2 weeks prior to your surgery, we're going to ask you to go on a very specific low-calorie, low-carbohydrate diet. This diet is not intended to generate a lot of weight loss. Now, that being said, most people lose between 5 and 15 pounds in this 2-week period. The real intent of this diet is to take the energy that's stored in your liver and deplete that energy so the liver is small and firm when we go to do the operation. Many studies have documented the shrinkage of the liver and the improved safety with laparoscopic surgery when people have this type of diet before surgery.